from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Wellness Wednesday. Dr. David Gerson joins us this week, and we're talking about a couple of things you got to watch out for while you're having fun in the sun during the summertime. Dr. Gerson, thanks for taking some time. First, let's talk about swimmer's ear. I know that this is something that's already been happening. In fact, some of our coworkers have kids that have already experienced this. So tell us, what is swimmer's ear, and how can we avoid something like this, which is typically a trip to an urgent care or a pediatrician out there to try and clear it up?
Or a family doctor. We see kids also. And swimmer's ear, actually, we see swimmer's ear in everyone from 6-month-old babies to 90-year-old grandmas. And swimmer's ear, it's an otitis externa, to be more medically specific. It's an infection of the outside in the canal of the ear, and it can affect the drum. So the drum can get swollen too, but you don't have the fluid behind the eardrum of what we're kind of usually accustomed to with middle ear infection. So this is an infection of the canal and anything outside the ear. And it can happen year-round. It's essentially from getting water in the ear or some other liquid substance, and that could be sweat as well. And it kind of just sits there and kind of brews an infection. The other big culprit is, believe it or not, just Q-tips. Everyone uses Q-tips, and they're not supposed to put the Q-tip in the ear. Your grandma always tells you nothing smaller than your elbow, But the Q-tip can scratch that skin, and that can cause infection, including a staph infection.
How do we prevent it?
Oh, sorry. Best thing is, 1, no Q-tips, right? 2, are some drops you can get, some diluted alcohol, diluted peroxide swimmer's drops, which are helpful. The best thing to do is, once you know that ear gets wet, so that you're swimming at the pool or you're swimming at the lake, go get to the bathroom, get a hair dryer, reach behind. I don't know if you guys can see me. Reach behind and pull that ear back, and just take that hair dryer in low setting and go back and forth for about 30 seconds. That dries out that ear, and very often that prevents it altogether. So watch those Q-tips and keep that ear dry, and then use, like I said, you can use some of those swimmer's ear drops. Those can be helpful.
Okay, we've got about a minute left, and look, we know about ticks in Arkansas. Anyone who's lived in Arkansas for more than a day knows about ticks in Arkansas. But,
Absolutely.
Of course, ticks are going to happen. It's part of growing up here. It's part of living here. But let's talk about some of the dangers that they do present, and how to know when maybe someone should go and get a look at a tick bite, and maybe just to see if it's something more.
So it's real important, and me being a Yankee from up north, learned real quick over the last few years about ticks. The ironic thing is Rocky Mountain spotted fever is actually more. We see it here more often than we do in Colorado or the Rocky Mountains.
Wow!
And so it's crazy. But so if you do get a tick, you have to learn how to take it off, and there are great YouTube videos on that, and also your doctor can teach you how to do that. But if you have a tick that attaches itself, you get it removed, you keep it clean. If that area starts to look like it's infected, then we want you to come see your doctor. The symptoms, though, very often people don't even know the tick is on them for several days, and so they won't have symptoms for anywhere between 2 and 14 days. And so if you're having headache, visual changes, you see a rash, you're getting joint pain, these are all very good reasons to see the doctor ASAP to get tested, and sometimes we'll even treat you while we're waiting for the testing to come back if it's a good story.
Okay. Well, Doc, thanks again for taking some time out of your morning to share this information with us. Hopefully people can stay happy and healthy out in the sun and have some fun.
Absolutely.
All right. Hey, if you'd like to that's right. If you'd like to contact Baptist Health, you can do so at the information on your screen. We'll see you next time, Dr. Gerson. Thanks again.
All right. Take care.